Namaste from the beautiful subcontinent of India. Honorable Dr. Kuiljeit, President of the Federation of World Peace and Love, Excellencies, distinguished co-speakers, ladies and gentlemen. The World Health Organization has designated the 10th of October as the World Mental Health Day, an international day for global mental health education, awareness and advocacy against social stigma. The overall objective is to raise awareness of mental health issues around the world and to mobilize efforts in support of mental health. This day also provides an opportunity for all stakeholders working on mental health issues to talk about their work and what more needs to be done to make mental health care a reality for people worldwide. The COVID-19 pandemic has had a huge impact on people's mental health across latitudes, in particular, health and other frontline workers, students, people living alone, and those with pre-existing mental health conditions. Ironically, services for mental, neurological, and substance use disorders have been significantly disrupted. Yet, there is cause for optimism. During the World Health Assembly in May 2021, governments from around the world recognized the need to scale up quality mental health issues and services at all levels. And some countries have found new ways of providing mental health care to their populations. The theme of this year's campaign, which is Mental Health Care for All, Let's Make It a Reality, will help to showcase the efforts made in this direction by countries as an inspiration to one another. WHO's comprehensive Mental Health Action Plan 2013 to 2030 sets out clear actions for member states, the WHO Secretariat, and international, regional and national players to promote mental health and well-being for all, to prevent mental health conditions for those at risk, and to achieve universal coverage for mental health services. The four major objectives of this action plan include more effective leadership and governance for mental health, the provision of comprehensive integrated mental health and social care services in community-based settings, implementation of strategies for promotion and prevention, and strengthened information systems, evidence and research. In the recent years, there have been increasing acknowledgement of the important role mental health plays in achieving global development goals, as illustrated by the inclusion of mental health in the Sustainable Development Goals. Depression is one of the leading causes of disability. Suicide is the second leading cause of death in the age bracket of 15 to 29-year-olds. People with severe mental health conditions die prematurely, as much as 2 decades early, due to preventable physical conditions. Despite progress in some countries, people with mental health conditions often experience severe human rights violations, discrimination, and stigma. Many mental health conditions can be effectively treated at relatively low cost. Yet the gap between people needing care and those with access to care remains substantial. Effective treatment coverage remains extremely low. Thus, there is a need for increased investment on all fronts, from mental health awareness to increasing its understanding to reduce stigma, for efforts to increase access to quality mental health care and effective treatments, and for research to identify new treatments and improve existing treatments for all mental disorders. Stress, fear and worry are normal and typical responses to perceived or real threats, and at times when we are faced with uncertainty or the unknown. So it is normal and understandable that people are experiencing fear in the context of the COVID-19 pandemic. Apart from the fear of contracting the virus, there have been significant changes to our daily lives, since our movements are restricted in support of efforts to contain and slow down the spread of the virus. We are faced with new realities of working from home, temporary unemployment, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues. And in such circumstances, it is important that we look after our mental as well as our physical health. I truly believe that it is the time to plan life skill interventions with the world population across continents and employ WHO's 10 core life skills that will help to strengthen and fortify the coping mechanisms and mental capacities of people. We all need to do our part in our own unique ways. As the National President of the Indian Women's Chamber of Commerce and Industry for Life Skills, I have taken a step forward in that direction, and I'm working towards creating a robust ecosystem of life skills for women professionals of my country that will strengthen and fortify the coping mechanisms of individuals in adverse times and amplify their mental and psychosocial health and fitness, and eventually make them more happy and productive as citizens. Mental health is essential to our overall well-being and as important as physical health. When we feel mentally well, we can work effectively, we can enjoy life better, and we can also contribute actively to our communities. We must try to reach out to people in our environment and society and as good human beings with a beautiful conscience, and do whatever we can, no matter how huge or minuscule, to ensure that we all live in good health and affability as global citizens of the world. Thank you. Namaste.